Hi, my name's Sarah Heenan, and I'm a family nurse practitioner student doing an HEENT video. So first I'll do hand hygiene as I walk into the room and introduce myself. Hi, I'm Sarah. I'm going to be the nurse practitioner taking care of you today. What's going on? Why are we here?
I've got a sore throat.
Okay, and can you tell me your full name and date of birth?
Nathan Foster, 03/01/95.
Okay, and do you know where you're at right now?
The doctor's office.
Okay, and the year? What year is it?
2018.
Okay, and you said you're here for a sore throat?
Mm-hmm.
Okay. So patient is alert and oriented ×4, appears clean and well kept, and he is a 23-year-old Caucasian male. So next I'm just going to begin with my history of present illness questions, and we'll start with the onset. So when did this all start?
It started 2 days ago and it's gradually gotten worse.
2 days ago, okay. And where at in your throat is it hurting? Is it one side or is it both sides?
Both sides, my whole throat.
Like all over. And then how long has it been hurting you? You said for 2 days?
Yeah, constantly the past 2 days.
It's been constant, okay. And then can you tell me about the character of the pain? What does the pain feel like?
It's sore and sharp on both sides of my throat.
Okay. And then does anything make the pain worse?
It hurts to swallow, eat or drink. Can't really open my mouth all the way.
Okay. And then does anything make the pain better? Have you tried any medication for it? Have you tried anything?
The numbing chloroseptic spray.
Okay. Has that helped at all?
A little bit, and some ibuprofen for the pain.
Ibuprofen, okay. Let's see, and then does it radiate to anywhere else, or is it just in the throat?
Kind of feel it back in my ears, to my ears.
Okay, let's see. And then timing, so what were you doing when it started? Any precipitating factors? Were you around anyone who was sick?
I had
any other symptoms or anything?
A little bit of a stomach ache and had a bit of a fever. Been pretty nauseous. I was babysitting my niece a few days ago who had strep, so.
Okay, so you've been exposed to strep throat. And you said fever, nausea, and stomach pain, and that all started when?
A couple days ago.
Okay, so around the same time.
Yeah.
Okay, and then severity, if you'll just rate your pain on a scale of 0 to 10, if 0 is no pain, 10 is the worst pain ever.
Probably 6.
6 out of 10, okay. All right, so now we'll move on to some more medical history. So do you take any daily medications?
Just Allegra.
Allegra, do you know how many milligrams?
180.
Okay, and you took that today?
Mm-hmm.
And then, let's see, ibuprofen you said?
Mm-hmm. And the spray.
And the spray, and when did you do the ibuprofen last?
This morning.
Okay. And then the spray you did today as well?
Yeah.
Okay. Any allergies? No allergies?
Mm-mm.
Any medical history?
Mm-mm. Just.
Anything you've been diagnosed with?
No.
Do you take Allegra for your seasonal allergies?
Mm-hmm.
Okay.
Yeah.
So anything else? Okay. Any surgeries for you?
Just like broken bones. That's it.
Did you have like surgery on your bones or?
Mm-hmm.
Yeah.
My wrist.
Your wrist. Okay. How long ago was that?
4 years.
Okay. And then let's talk about social history. So any drug use, any drinking, tobacco use?
No drugs, no tobacco, weekend drinking.
Okay, just casual. How many? Like a few drinks?
Yeah.
A weekend? Okay. And then do you work? Are you in school? What do you do?
Work, yeah. I'm in school, college student.
Where do you work? What do you do?
Mechanic.
Mechanic, okay. And then who do you live with?
My girlfriend.
Okay. Let's see. So you're single, you're not married. Okay, and then for like exercise and diet, do you exercise often?
Yeah, almost every day.
Every day, and then eat healthy occasionally?
As much as I can.
Yeah, okay, good. Let's see. So then family history, we'll talk about just mom, dad, and then any siblings that you have. Any like heart disease, cancer, hypertension, diabetes? Nothing that any of them have been diagnosed with?
No.
Healthy family? Okay, good. So then I would take vitals as part of my physical assessment. So his temperature was 101.3, so he is febrile. His heart rate was 92, respiratory were 16, blood pressure was 116/72, and oxygen saturation was 98%. So then I would do a review of systems just to see if I'm missing anything or if he left anything out. So we already know he has abdominal pain. He's got a sore throat, fever, and he's nauseous. So I'm just going to ask some more questions to try and figure out which way I should go with this. So have you had a cough or any respiratory issues with this? No? Okay, good. Any like diarrhea, constipation, anything? No. So no other symptoms that I'm missing, any like heart palpitations or anything else abnormal? Nope. Okay, good. Any chills or body aches? No.
Nauseous.
Okay, just the nausea. Okay, so I will move into my physical assessment, which is just going to be a focused HEENT assessment as well as cardiac and respiratory. So with my stethoscope, I would first listen to the 5 oscillatory points, which are the second intercostal space, right sternal border, and left sternal border, and then third and fourth intercostal space, and then the apical in the midclavicular line at the fifth intercostal space. So that's where I would place my stethoscope and listen to heart sounds, and S1 and S2 are present, no murmurs noted. And then I'd listen to breath sounds, and I'd listen anteriorly in all lobes. And then I would listen posteriorly as well in the same lung fields. And breath sounds are clear and equal bilaterally, no adventitious lung sounds heard. So next I'm going to do a focused HEENT assessment of mainly the throat. I will check his ears since he said the pain's radiating to the ear. So I would use my otoscope to look in the ears, which I don't have, so I'll just mimic what I would do. I'd pull back on the ear and look in at the tympanic membrane, and I would look for any drainage or erythematous tympanic membrane, and I would do that bilaterally, and so no drainage was noted, no erythema noted on the tympanic membrane. So next I'm going to check the back of his throat and mucous membranes, since that's what he's saying is hurting. So I'll have you open your mouth first, and I'm just looking. I have my light, and the mucous membranes are pink and moist. No dryness noted. Next, tongue is midline. I'll have you stick it out and say ah. Okay, so in the back of the throat, I note erythematous, enlarged tonsils on both sides. Let's see, white exudate noted bilaterally on the tonsils as well, and then erythema and petechial rash noted on the soft palate and enlarged uvula. Let's see, so after that, I would check for any lymph node enlargement. Some common areas would be the posterior and anterior cervical lymph nodes, and those are usually enlarged with either bacterial streptococcus or infectious mononucleosis. So I can just palpate all of his lymph nodes, starting in the back, and then working my way forward, feeling for any enlarged lymph nodes. And then I'll just go down the side. And I did note enlarged anterior cervical lymph nodes. So my 3 differential diagnoses would be bacterial streptococcus group A, pharyngitis. I could do viral pharyngitis if he had no fever and other viral symptoms such as a cough, but that's not likely because he does have the fever, so I'm leaning more towards the bacterial pharyngitis. And then I could also test for infectious mononucleosis, and I'd also want to rule out peritonsillar abscess. Even though he says it's bilaterally, usually that's unilateral, and I'd be able to see one side enlarged over the other, but I would still want to rule that out and make sure that that's not occurring. And I think that concludes the video. Thank you.